we'll do is we'll ask our first presenters to come up and join us. And just as a reminder, we are webcasting each one of these sessions, so smile for the camera. In addition to that, I'm just wondering, and I'll turn to my friends if they want questions throughout the presentations or just wait till. So questions throughout. So questions throughout the presentations are welcome. Just raise your hand and we'll turn it over. So.
Questions for each of the pillars.
Okay, perfect.
So I think we should get the deck projected, or? Thank you. Okay, so we'll start off today talking about the strategy for Safer Ontario. I'm just going to give you a bit of an opening as to sort of what the strategy looks like and what the plan's all about. Then I'll turn it over to my colleague Nicole, who's really the specialist around the community safety and well-being pillar and what that looks like. And then I'll take it over again to take you through some of the other pillars of the strategy around what police do, accountability, and First Nations policing as well. So if you want to go to the next slide. Just briefly wanted to mention that there are multiple ways that policing is delivered in the province. There's municipal policing, there's the Ontario Provincial Police, and there's First Nations policing, of course. And really what the strategy for Safer Ontario is trying to do is to look at all of these different methods of policing in terms of their adequacy, effectiveness, confidence in their oversight and accountability. So really looking at not just one method of policing, but all methods of policing across the province in a really holistic way. So if we go to the next slide. I'm really just giving you an idea of what the strategy for Safer Ontario is all about and laying out the plan. So as Nathan mentioned, the Police Services Act hasn't been comprehensively updated since about 1990. So it really is time for a rethink and a rewrite of what policing, what our goals for policing are in the province and what policing looks like. We know that there's a number of really specific challenges that are being faced today. So there's a lot of reactive, resource-intensive sort of emergency responses associated with traditional policing, where the province really wants to move to a more proactive and preventative model of policing, where we're really able to engage on the community side and do some of that community policing. There's also the changing nature and complexity of crime in some ways. So even though the crime rate is decreasing overall, there's some new sorts of complex forms of crime that communities are facing. There's increased demands on public safety personnel as well, and as well as increased demands and challenges regarding human rights and civil liberties. And this will be critical when we talk about the idea of accountability to the public and oversight as part of the policing system. And really, just as I mentioned, that outdated policing framework. So something that was built for 1990, a very different context than what we're trying to build for today. So really wanting to look at that. So if we look at the strategy for Safer Ontario, there's really 4 key pillars that we've included in the strategy. The first one is around community safety and well-being. As I mentioned, my colleague Nicole will take us through the specifics on it. So looking at a collaborative approach to community safety and well-being at the local level, as well as improving some of those police interactions with vulnerable individuals, because we know there are specific issues that are faced there. Then looking at what police do. So really looking at what are those core responsibilities of police, where are maybe some opportunities where some alternative types of personnel can assist police in the duties that a police service is executing and carrying out, and how can that really help in ensuring more effective policing overall. And then enhancing professionalism, education, and training. So I know training is going to be a key piece for us. Really talking about some of the key pieces around cultural competency as well is something we want to cover today. And then looking at increasing accountability to the public as our third pillar. So looking at the sort of local governance, the police services boards, as well as the broader oversight system as well. And really taking a more active ministry role in sort of the oversight of police services, community safety personnel, to make sure there is that accountability to our communities. And then finally, the sustainability of First Nations policing. So we're going to touch on, again, providing some of those more flexible and enhanced range of legislative options for First Nations policing, and talking about how that impacts sort of service delivery and funding as well. And so really we want to bring these to some new outcomes for policing. So strengthen partnerships between police and the communities and people that they serve. Really a new community safety services structure that really clarifies those core policing responsibilities and provides updated and really modernized training requirements that fit with that. Enhanced and more consistent oversight and accountability for communities, and also sustainable and supporting culturally responsive policing services in the province is critical for us. So with that, I'm going to turn it over to Nicole, and then we'll go from there on community safety and well-being.
Thank you, Tiffany. Good morning. So, if you could just go to the next slide, slide 4. Thank you. So we're going to talk a little bit about community safety and well-being. So the community safety and well-being term is actually a term we use now to describe the old crime prevention. And the reason for this is because crime prevention is often thought of as the responsibility of police. And it's clear that it's not just the responsibility of police. It's police working with other community partners to make sure that those people that are falling into the criminal system are getting the support they need before they actually fall into that system. So the strategies approach is about requiring collaboration, prevention, and a locally based approach. So, and by collaboration, we mean that police are working together with municipalities, the communities, the service providers in the community, the First Nations leadership. And then by prevention, we mean that there's many different zones of prevention. There's, kind of prevention by stepping in right at the moment when someone's about to deal with a crisis. Things like situation tables often deal with those types of things. Then there's also getting further back into the prevention and social development areas. So about putting in programs that are, actually getting people when they're young before they're going to fall into the criminal system. And by locally based, what we mean by that is that we're actually focusing on the problems and the risks in each area, because we know that the problems and the risks that Toronto faces would be very different from Thunder Bay and from a particular First Nations community. We want to make sure that each community has the ability to address the risks that cause the problems in their area. So ensuring community safety and well-being requires that provincial, municipal, and First Nations partners and service providers and community members collaborate to identify and address those priority community risks. Such risks might be mental health and homelessness, to implement strategies for the prevention and social development of those before those risks happen, and build trust and relationships between those community members. By doing this, we want to improve outcomes for residents. So working together, partners will be able to ensure that those in need get the right response at the right time by the right service provider, and that's really what we're trying to do here. If a police officer is responding to someone, for example, in a substance abuse crisis or a mental health crisis, it's not helping that person get the services they need to help that not happen again. It's just taking them to a hospital and not really addressing the underlying causes. So we want to get away from that. So the key initiatives under this community safety and well-being pillar that I'll talk a little bit more about are 1, mandating community safety and well-being planning. 2, providing toolkits and funding supports to undertake that. And 3, I noticed the numbering is a little off. And serving vulnerable Ontarians. So first I'll talk about the mandate. It's on slide 5. And the ministry is looking at how community partners, so municipalities, service providers, and community members can all work together to develop these community safety and well-being plans to address local issues. So what we're considering is making municipalities accountable for the community safety and well-being process. And they would then be able to establish a steering committee with representation from multiple sectors. So that's how we'd really get that multi-sectoral lens on these plans. The police services boards would be mandated to work with the municipalities to develop the plans and also align their strategic plans with the community safety and well-being. So that's how we'll link in policing with the community safety and well-being planning process. First Nations would not be required to have a community safety and well-being plan. However, we would encourage them to engage in the planning, and they would have access to our ministry supports to do so. And also the ministry would have authority to inspect plans. Yes?
Is there an intention that the First Nations have the extra support that might be required to do that? So you're saying that the municipalities are mandated, First Nations won't be, but and what happens if there's a gap there for us to have to fill in on our own? And is the ministry intending on supporting our needs more specifically to a local First Nation issue?
Well, yes, absolutely. So the mandate would not be there, but the supports, which I'll go through on the next slides, will be available for those who want to undertake that process, definitely. Mm-hmm. Well, this is all what we're proposing anyway. Yes.
I'll reserve my question until I see these slides.
Okay. All right, we'll move on to slide 6. Thanks. So ministry supports will include the community safety and well-being planning framework, and it's basically a toolkit of practical guidance on how to develop a community safety and well-being plan. So it's like a very, a how-to manual of how to go about community safety and well-being planning. This was developed over the course of extensive consultations and planning pilots, including Rama was one of our First Nations pilot communities. And the implementation of local plants would also be supported through a new grant program. The ministry is exploring the development of a community safety and well-being focus grant that would be linked to outcomes. So grant recipients would need to demonstrate that they are achieving those identified outcomes and requirements. And so beginning in 2018-19, so our next fiscal year, we're exploring implementing a new transitional policing effectiveness and modernization grant program. This is for police services, and this is to help prepare them for going through into the community safety and well-being grant. So in future years, what we're exploring is that full transition to the community safety and well-being grant, and this would be available to municipalities and First Nations communities. So MCS will continue engaging the community, policing, and First Nation partners on grants transformation. As we know, this is a very substantive topic to get lots and lots of input from, and we'll consider changes based on the outcomes of those engagements.
So does that mean then that new dollars will be provided to First Nations for that responsibility to be part of the community safety, to develop programs in which to engage with First Nations that are at risk, or to provide social support programs for these First Nations that are at risk?
Thank you.
Is that, so again, is that just that new dollars and support dollars for existing programs? If the responsibility is being passed off on police to include communities, how exactly does that fit to the framework in terms of dollars?
So what we're proposing is actually new dollars for First Nations communities. Some municipalities will have access to that as well. So, and basically what we want those dollars to go towards is implementing those programs that are related to the preventative aspects of community safety and well-being.
So what's the proposed amount? If you're
We actually don't know that yet.
okay. Thank you.
Yes.
These grant applications that you're talking about, I know in a lot of, on a broader scale, when grants are brought forward, organizations actually hire people to complete the application process because they are so complicated. Is there going to be an effort on Ontario's part to possibly streamline this, or at least make it a little more user-friendly than your typical grant application?
Right.
If you're talking about government communities making these requests,
Right.
if they're overwhelmed from the front end, if they may not actually complete it, and ultimately there's money that's going to be left over at either end, where people are more successful in completing a grant application if you support it and those that are able to meet
Right. That's feedback that I have heard. And so we haven't gotten into the actual implementation kind of aspects of it, but that's definitely something we're hearing. So we are exploring the possibility of maybe streamlining the grant proposal process, of going and doing workshops across Ontario to make sure that people get familiar with the process and have the right education for it. So definitely I'll take that back, and we're open to any suggestions on how we can streamline that process, because I know it's a difficult one. Yes.
Three questions. First question, I guess, what's the process of why are you choosing to go into a grant stream as opposed to working with First Nations? So like something similar with the family well-being program where that money was kind of, I guess, negotiated in a way where communities have access to it, where they could start right away in terms of building their community, their family well-being programs and strategies. So that's the first question.
Okay.
And then again, is this relevant and related to the family well-being strategy that the MCYS is rolling out? And is it part of the Walking Together strategy? So it's kind of, those questions are all
Right, right. So it actually is a component, we've included it as a subcomponent of the Walking Together strategy. We do feel that the broader goals are similar. We like it to be in a grant format because it does, it fits our proposal of having everything be outcomes based and kind of outline which programs and things we'll be supporting. So we get to keep a good, framework of how we're analyzing and evaluating the grant or the proposals. So that's why we picked that as our approach. Sorry, did I miss your second question in there? Or okay. All right. Yes.
How is Ontario engaging with Indigenous young people in terms of the PTOs and stuff like that? I mean, are you guys engaging with them in terms of encouraging youth-based initiatives? Because I know in terms of the concerns from one of my colleagues here was that is this user-friendly in terms of the application process?
Mm-hmm.
So as part of the Ontario First Nations Young People Council, is this something that we'll be able to understand, will we be able to engage in, as well as who exactly is going to be able to most benefit from these dollars? I mean, are individual PTOs going to be able to come up with their own initiatives in terms of, because it's young people that are disproportionately involved in the criminal justice
Mm-hmm.
system. So how is Ontario engaging with these youth groups, such as myself in G3 or
Right.
probably UI or anything like that?
So we have a couple different areas that I can highlight. So one thing we are looking to, and again, all these parts are not quite finalized yet, but one component we want to do, build into the grant is the youth population in a community. So, because we recognize that, just what you've said, and that the funding dollars do need to be tied to the amount of youth that are in the community. Second, in that booklet, the number 3, the community safety and framework, community safety and well-being framework that I mentioned, and the ministry supports, also has a tool in our toolkit on engaging youth, which we actually worked with MCYS to, they developed and we put it in our framework. So we want to make sure that when communities are developing their community safety and well-being plans, that they are really engaging their youth populations as well as other local vulnerable populations in developing those plans.
So it's the responsibility of the First Nations and the municipalities to engage with their young people?
That's what we're proposing, yes, that it will be in that mandate to engage with their vulnerable communities. Mm-hmm. All right, if that's it, then I'll just move on to the last slide. Or actually, we have a few discussion questions. We've had some good discussion already, but just in case there's anything else we want to add. On slide 7, how can the ministry best support community safety and well-being in planning in First Nations communities? We're definitely open to taking feedback in ways that can help us help communities that want to undertake this kind of community safety and well-being planning. So, and by all means, if there's things that are thought of after the fact, we're happy to take submissions afterwards. Number 2, how can municipalities, if mandated to lead the development of community safety and well-being plans, best work with First Nations community members and leadership? Any thoughts on that? And what types of priority areas might be the focus of a community safety and well-being grant? I know we talked a little bit about how the youth population in a area will play into that. For example, service providers delivering new or better coordinated services. So this includes things like social navigators, situation tables, and new or better services and programs. This could include research into community assets, needs, risks, or best practices, and jurisdictional scanning to inform those strategies and deciding on which programs to implement, and determining outcomes and monitoring and evaluating success. Okay. We'll go on to slide 8. So this is very much related to the last piece I did about community safety and well-being, but this is about specifically looking at how police are responding to those who are in some type of mental health crisis. So a key part of community safety well-being is improving those interactions between police and vulnerable individuals, such as youth with mental health or addiction issues. The problem is police are increasingly responding to calls for service that are not always criminal in nature, and these calls often involve individuals who may have been better assisted by another service member. So I won't go over some of the key statistics. I think we're all definitely familiar with that police are often called to these situations when they're not necessarily the most appropriate service to respond. So I'll go on to slide 9. So these service calls often involve individuals who would be better assisted by other community health or human service providers. Coupled with the improved coordination of public safety services, the strategy would also improve police interactions with vulnerable individuals who may be experiencing mental health issues. So what we want to do is improve those transitions between police and hospital workers. So what happens often is that someone experiencing a mental health or addictions crisis will be apprehended by the police officers, and then the police officers will escort that person to the hospital, where they'll end up staying there for hours upon hours upon hours, and the person isn't necessarily getting the service they need. The police officer is then not able to respond to other calls while they're held there. So the ministry is considering developing a framework to help improve those transitions of individuals from police officers to hospital workers. And we're also considering requiring police officers to use a standardized mental health assessment tool that will help them basically communicate a little bit better to understand what the person's going through. Mm-hmm.
In municipalities, that's a great idea. You have, let's use Thunder Bay Police, for example, they're using mental health workers when someone's in a position where they could be apprehended with a mental health act.
Right.
So that worker assists, the worker gives the information to the doctor, but the ability to have that person form is more successful than a typical police officer trying to express to the doctor what's going on.
Right. Mhm.
but the accessibility by some of our folks extremely limited, if non-existent altogether. So while it's great to say we're, as Ontarians, doing these things,
Mhm.
how is it going to happen in our environment? Because it's, as it stands right now, it's almost impossible.
Right. We're still exploring that, so I don't have an answer on that yet. But I'm going to take that back, definitely.
Are you guys looking to partner with established organizations in terms of mental wellness that are already sort of providing these services to police? I mean, if it's going to take a while for to engage in terms of training police in terms of becoming mental health and wellness, and to establish and know when it's a crisis situation, when it's a mental wellness issue as opposed to a criminal or violent issue. I mean, like for instance, my father, as a mental health worker, has gone into housing already where there was somebody armed. The
Mhm.
police didn't go in, but they were called in, and they went in to deal with the person's mental wellness issue. They diffused the situation. So, are you guys going to be partnering to provide more training, or and to partner with these organizations to train police that are already doing these sort of works that you guys are already talking about?
Right.
Because in Treaty 3 especially, I mean, we have a bunch of island communities where police aren't going to be able to get there or respond in terms of in a quick nature.
Mhm.
And as well as, yeah, I mean, that's a really key point too that I'm asking is, are you guys going to be working with First Nations to train you so that these island communities or our isolated communities can be able to respond quickly to these sort of situations?
Right. So I'll just respond to that in kind of two different ways. So we are going to talk a little bit about police training later in there, so I won't go too into that yet until we get to that section. But yes, we are definitely examining how police are trained and how we can improve that, for sure. The other part is that you raise very good points in how police are communicating with those service providers and the availability and access. So that would be something that if that was a common risk in an area that we'd suggest be included in that community safety and well-being plan. And how can we improve that service to get in to those areas that might need it, that's not currently done right now. So that's definitely an area we'd want to address with community safety and well-being planning. Yes.
Yeah, I can see this working well with some of the communities that have a hub model concept or a
Mhm.
collective that's working towards common community goals so that they don't go in and try to change or upset an administration that's already doing some things. They have to have that core knowledge of what's going on. And I think that that's where it would fit in, but I'm not sure that we have a whole lot of communities that are operating at that level, maybe with the exception of Moose Creek.
Mhm. Mhm. Absolutely. I think there's definitely a scale involved in how much this can be done, but basically what we believe is that at any level, through collaboration, we can definitely improve what's being done. So maybe, for example, some communities that are in the same general area could perhaps, partner on a community safety and well-being plan initiative that could utilize some of the community's strengths. I mean, I'm just hypothetically speaking, but I hear that definitely, and we want to support. Like our role will be to support it. So we want to do whatever we can to help establish those, ideas that can help improve.
I could see it working in PTOs and tribal council levels too, because they're already delivering on
Mhm.
some of those initiatives.
Mhm.
Maybe a chance to grease the wheel of the machine a little bit would work as well.
Right. Thank you. Okay, sorry, I think you first. There.
Sorry that I was speaking a little more loud, and I have a bit of a problem with my ear. So what's the remote communities, have we done any research or taken into consideration our remote communities or the situation they're in? There's really not much access to it.
Right, exactly, and we definitely recognize that as well. We'll provide some challenges and barriers, but our toolkit, what we think it will support every area with all kinds of different capacities in helping establish some kinds of supports for each community. So, I mean, for example, we have an asset map toolkit, which will help you identify what you have in your area. And it's also about connecting in with their other nearby, or I know it's remote, but other nearby communities that could perhaps, could there be better access between the two? I don't know at this point, because we do want it to be locally based, but we do want to use whatever resources we have between the toolkit and the grant to help build up services in each area, no matter how remote.
Yeah, I just hope you understand that our communities are client communities. There's no summertime, even though if you have a neighbor.
Right, you can't really get there. Yeah, I mean, we'll be definitely having once things get off the ground, we will be, visiting different communities and trying to find ways that we can enhance the program. We do recognize that that remote communities do have those particular challenges, so we will be talking with some of those communities to gather, different ideas and ways that we can support them. So we'll definitely be working on that. Absolutely. Yes.
So in terms of talking with these remote communities, and in terms of Treaty 3, then would the ministry be open to getting on boats in Kenora and experiencing themselves how the length of time it takes to get from a place where the services are provided to a remote community, in terms of our islands, where those services aren't there or they're not supported properly, in terms of to engage with these nations?
Well, we'll definitely be doing a bit of that. That's for sure. Yeah. Yes. Sorry.
I think it's great too, where there is an opportunity to share with in a bigger municipality, it'd be nice if the First Nations were considered as a partner to that. So if you develop a program for that city, whether it be Peterborough, Sarnia, Brantford, something like that, where you have a First Nation community service related to that service provided for in the mental health field is also acknowledged that they are going to support us, because we may not have the numbers that, for example, Brantford has, where they have a nurse that rides around in the police car with them and that has some really good stuff going on there. But when we do need them, we lose a resource that is equal to probably 5 or 10 other officers being taken off the road at once, because that's their only person working, or maybe there's 2 and they're both gone on mental health
Right.
for hours. So it has the same impact. So it'd be nice even if we could say, okay, they have the person working tonight, can we share that resource with you, as we now have a person that we need to have taken to the hospital. We don't show up and say, okay, Brantford, they have a great system, too bad they're not gonna sit there and wait. So just keep that in mind when you're developing this, that if we could share in that, those resources as First Nations that go to those major centers, that would be kind of nice that
Right.
you're considered part of it. We don't have to get it, we're not excluded just because we're not under the program.
Right. Right. Okay. Thank you.
I know you talked about an evaluation as this grant process goes through. A lot of the things that are in this area is extremely difficult to measure successes. So in the event that it's up for a renewal and we're coming for the same request, and how would the ministry then look at our renewal application? How do they measure success? A lot of things are an event that goes on in regular values. We did training for, we had a lot of incidents where young ladies were blacking out and being sexually assaulted. We ran training as a result of that in our communities. We were never able to measure the success rate, and there's a one-time grant.
Right.
Something like that is extremely hard to measure. You could look at the statistics and, all right, maybe we didn't have any more, maybe at least the education got out there and stayed away from it. Maybe what they could stay away from that kind of environment. Now, in this case, we may be looking for flexibility like that. Would the ministry be willing to allow for that flexibility, that this isn't a short-term fix, this is
Right.
over periods of grant after grant after grant, and then we'll see the impact. And my question is just for the ministry to be willing to look at it as a long-term fix as opposed to an immediate, now we
Right.
need to see the statistics, sorry you didn't make it. Your
Right.
application's been rejected.
I hear you there. We're still, again, looking into the particular details. We would like to have a longer term than some of the other grant programs have, such as the Proceeds of Crime grant that's 1 to 2 years max. So we like to work, we want to work with the applicants for developing like achievable evaluation strategies. So, which includes, short-term and intermediate-term goals as well as long-term goals, because sometimes if you can, demonstrate that you're meeting your short-term goals and at least on your way to meeting those long-term goals, then that's something we could definitely take into consideration. We do want to keep that, our approach is definitely keeping with the outcomes-based, but we want to try to see what we can look at in terms of term length to, help make that happen. Mm-hmm.
The alternative justice models that are established for First Nations people, such as like the lodges and stuff, where First Nations take responsibility for their criminals bringing them back into the community and kind of provide them alternative healing for certain crimes. I remember reading an article how that's a right and something that we should be allowed to do, but there's no supports in terms of building these lodges or building these spaces
Mm-hmm.
to house these people in terms of to provide them that healing. I think there's only like 5 or something in Canada, and they're only just starting to sort of get a little bit more funding as they go.
Mm-hmm.
How is the ministry going to be providing for these types of alternative justice models that are First Nations based in terms of to heal these mental wellness issues that we've already
Mm-hmm.
known for quite a long time, and it seems that the ministry is just kind of trying to catch up now.
Right.
So is that included within the Safe Ontario framework? Because as we know that jails only really create more criminals essentially at the end of the day. That the alternative that they're going to be involved in the revolving door,
Mm-hmm.
but that these community wellness programs for alternative justice have proven to reduce crime for First Nations communities. How is that going to be? Is that included in the framework?
You are singing from my songbook, sir. So I completely agree that there need to be strategies that are, and that's where we get back to the locally based part, is that we want to ensure that strategies are culturally responsive and that they actually make a difference in the community. So that I would argue would definitely be something that could be considered as part of the as the plan.
The strategy and legislation is already there. It's just the supports that need to be there.
Right, exactly, and that's what we're working toward, definitely. Mm-hmm. Yes.
So, will there be like supports for just like capacity building for building like the community safety and wellness plans? Because I think that's like also a really important issue. Because like while you want to be working with like First Nations communities, but not all of them have the capacity to like,
Right.
be able to like build these plans. And so like funding and supports for that would be like super important. But I also think when you're thinking about grants, like some of your short-term, longer-term goals can just be maintenance. And I think that that's something that you should be considering, like maintenance costs as a short-term goal.
Okay.
Because that's just pretty basic.
Right, right. So I thank you. I take that point. We haven't yet determined if we can include capacity building and kind of that, those planning and preparing aspects in the grant, but we're looking into that, and I'll definitely take that back for feedback. Thank you. Okay. So we have a few discussion questions on slide 10, just to finish up this the community safety and well-being pillar. So who should be involved in responding to and serving vulnerable individuals in First Nations communities? Yes.
Definitely families. Like,
Yeah.
Because like even in Canada, like Delaney Coconuts, her family's been saying for like months that like she was murdered, and the police are not listening to her at all, and that's like Canada OPP, and they like totally shut down the case. Even though they keep saying the family's saying nonstop that there's been something wrong with her case, and further to that, there was police involvement in like
I definitely agree. We want to engage, the whole community in part of this process as well. Mhm. Okay. And so are you aware of any examples of response team models for serving vulnerable individuals, including those with mental health concerns, that you think we should learn more about? Oh, yes. Yeah.
Back to my first question. I'd like to know how the Safe Frontier strategy is incorporating local CFS organizations, because I know even from Kenora as well, we had Ms. Ray Kogopanes who had committed suicide after she had been dropped out of the hospital by the OPP. One of my biggest questions is how is the Safe Frontier strategy holding these CFS organizations to account in terms of, because where was the CFS? She was in care. Where was the care worker? How is the Safe Frontier criticizing these CFS organizations who don't have, they might not have the support, or maybe their policy is lacking, or maybe their provisions of care. Whatever the case, how is Safe Frontier strategy incorporating those organizations as well into the greater framework of developing better policies and making sure that young Indigenous people, who are the majority probably of care populations, being cared for properly?
I'm going to actually let the accountability and governance sections speak to that question. So it's not necessarily a part of the community safety and well-being pillar, but you do? Okay.
Like
Yeah.
being in CFS is being in care. You're in custody still. And it's not like police custody, you're still in CFS custody. And under custody and when somebody kills themselves or somebody dies, that's still an accountability part of police, it's still an accountability part of the CFS organization. Right? And so I think that it is actually a community wellness plan issue.
Okay.
Before in terms of even bringing social services to the table and how to make sure that they come to the table. So we're actively looking at that because we know that everybody has to be accountable and work together. And so it is a challenge for sure, but we certainly recognize that it is part of the whole PCC process. And we're also working with all the different ministries on this for all social services to figure out how to do this.
Okay. All right. So were there any? Did we want to? Oh, yes.
Morning. I guess just one of, when you're talking about involvement, who should be involved, have you guys done the research on past inquests that have occurred in Ontario? Because back in the 90s with the Selena Saturday inquest and in the recommendation, it talks about having police involved, CES organizations, the parents, mental health workers, the nursing stations, and for both communities, Treaty 3 and Missionabeg. Those things are in place. However, there needs to be that capacity built, and a model that was suggested in the Selena Saturday inquest needs to be further examined by the ministry.
Mhm.
Because some of those answers are in there if you look.
Right. I definitely, a common theme in the coroner's inquests and coroner's reports is more collaboration among different service providers. And what we are trying to do is allow the local flexibility to determine who those partners are. So that's why what we're saying is that there must be collaboration. We'd like to, leave it up to local communities to decide who needs to be there. But we do have some, we think mental health and social service agencies are absolutely critical to those partnerships to make this work. Absolutely. Yes.
So with, in terms of applying for these grants, do communities have to abide by the criteria of the ministry? Because as some of my colleagues pointed out, there's already probably strategies in place for developing a safer community that might be different than as opposed to kind of what the ministry has for their criteria, that our community has their own base criteria for what a safe community provides. So will they have to follow that rigid
Well, what we want to ensure is that with, like, we haven't got, now, when we actually roll out the grant, there will be grant guidelines, which will be a little bit more specific than what's in the legislation. But in terms of what we'd want to see there, we simply want to see that, that the community is implementing strategies that will address those risks that the community has identified in their community safety and well-being plan. So essentially what we just want is for it to be responsive to those risks, and to have a plan for evaluating the programs. Whereas we don't want to get too specific about what particular programs need to be there. Yes.
As a ministry, been working with the Ministry of Health and Long-Term Care. I guess just because when you're talking about policing in remote and isolated communities like the Treaty 3 Man and National Territories, there's a long way to go from Bearskin Lake to Sulica to get mental health services. There's not that many mental health workers in the communities. And when you're talking about capacity building and having that training for your toolkit with policing, are you considering the health staff that are placed within the nursing stations or the medical centers that they do have in those communities?
Right. We are definitely trying to work with the Ministry of Health to have them fully understand what we're trying to do, and I hear you that resourcing it's definitely an issue. What these plans are basically about, kind of making the most of what's currently available and then potentially using the grant to enhance what's there. If that's identified as a particular risk in an area, then maybe that's something that can be identified in that grant proposal. But essentially, yes, we are working with health to make sure our approaches are aligned.
One of the things that we're also looking at is potentially mandating participation of local health integration networks in the community safety and well-being planning process so that they can be at the table to understand where their resources are needed, where they need to target capacity, and where that support can be built. And so that way we can build that capacity. That's something that we are talking to the Ministry of Health about, and I think it'll be important to have WINS at that planning table since they really control the levers in local communities.
There's a lot of communities that don't participate within them.
Yeah. So that's where we are also working with the Ministry. Sorry. So that is where we're also working with Ministry of Health to look more broadly at how can we build some of the capacity. When we were talking earlier about mental health supports, we know that communities don't have the resources for things like multidisciplinary care teams or mobile crisis response teams. And how do we get the Ministry of Health on board in terms of providing that capacity? That's a conversation that we are trying to have because we do know that capacity across Ontario varies from community to community. And how do we build that up, especially since the mental health supports are a very important part of community safety in a number of communities.
I guess just right along with that, it almost has to be like a tripartite discussion because if an individual requires transport out of the community, Health Canada pays for that. It's not the province that pays for that. So how is that whole process going to happen if that person that's being transported from NAPS to the health station to Slipknot? That has to be a tripartite discussion as well.
That's an interesting point. I'll make note of that. Yes.
Just as part of this conversation and many others, I think it's important that, I've said this before we met, that it needs to be somewhat enshrined into policy or something that we're just not the flavor of the day. Because right now it's a good time for us, and I think recognizing where we're at with the advantages we have, we recognize that First Nations policing communities are struggling and all the challenges and so it's all really great talk today, but I'm worried that when this government isn't in, the next one comes along and squashes it simply.
Thank you. Okay. All right. I think then we will move on to the next pillar of what police do, unless there's any other questions. Well, thank you very much for all your thoughtful feedback. That's been very helpful for us.